This is a very brief one-slide PowerPoint that discusses the coronary anatomy of the heart. For testing purposes, you will need to know the main arteries of the coronary anatomy as well as the parts of the heart that they perfuse. Next slide. The coronary arteries are blood vessels that provide oxygen-rich blood and other nutrients to the heart muscle. The coronary arteries receive blood supply from the aorta at the aortic root. The coronary arteries attach to and wrap around the heart surface to provide circulation to the heart muscle. The right coronary artery branches off to the posterior descending artery and the right marginal artery, which supplies blood to the back of the heart. Take note of the light pink vessels. This includes the right ventricle, the inferior wall or the bottom of the right ventricle, and the posterior wall. The right marginal branch usually extends from the right coronary artery and supplies blood to the lower right side of the heart. The left coronary artery has the left main, or the area of the artery just before it branches off to become the left circumflex and left marginal arteries. This is important to note because when there is occlusion of the left main, all supply of blood to the left ventricle is blocked. So an MI resulting from this blockage is what is called the widowmaker. The damage to the left ventricle is so severe there is very high mortality. The left coronary artery branches off into smaller arteries. The most prominent ones are the left anterior descending artery, which supplies blood to the anterior wall or front of the left ventricle to the apex of the heart. It also has the left circumflex artery, which encircles the heart muscle, supplying blood to the back of the heart. Remember I said earlier the posterior wall has blood supply from the posterior descending artery? Now we know that the posterior wall also receives blood from the left circumflex artery. So, with its dual circulation to the posterior wall, we see very few posterior MIs. Remember, the conduction system also gets perfused in order to function appropriately. The right coronary artery perfuses the SA node. If there are problems with perfusion to the SA node, you might know that you're going to see heart blocks or other dysrhythmias occurring from the SA node. The left coronary artery perfuses the bundle branches, the bundle of His down into the bundle branches. So again, for the purposes of exams, you will need to know the different coronary arteries and the areas that they perfuse on the heart. Thank you.